Next, we have the president and co-founder of Fifth Sense, Duncan Boak, who's going to be speaking to us about the exciting endeavors that they're doing in the UK to raise awareness about chemosensory testing.
Thank you very much, Mark. Hello, everybody. Good afternoon. So, firstly, I'd just like to say a big thank you to Valentina, Steve, Mark and Kai for kindly inviting me over to speak. It's really great to be here, to be part of this really important event, which I found yesterday and today really exciting and inspiring. And yeah, we've all got a big challenge ahead, but quite an exciting journey as well. So, introduction to, yeah, I'm going to be talking a bit about the work that Fifth Sense is doing in the UK. Firstly, a quick introduction to Fifth Sense, an organisation whom some of you will be aware of. So we're the UK charity for people affected by smell and taste disorders, established in 2012 by myself and otolaryngologist Professor Carl Philpott, who some of you will know or be aware of. Carl, the year before I was introduced to Carl, he'd set up the UK's first NHS smell and taste clinic. I was introduced to Carl. I lost my sense of smell as a result of a head injury back in 2005 when I was 22. Yeah, I was introduced to Carl, had the idea to create the first of its kind organisation and set up Fifth Sense, and we've been working together ever since. And Fifth Sense, we exist to transform the lives of those affected by smell and taste disorders, and our work covers three main areas: the provision of direct support and information to people affected by smell and taste impairment and their families, public awareness and increasingly education for professionals, and then also supporting and facilitating research as well. We work in partnership with researchers around the world, mainly in the UK, around yeah, increasing research into smell and taste impairment. In terms of my own experience, well, as I say, 2005, age 22, I had a nasty fall down a flight of stairs and landed on the back of my head and woke up in hospital. And it was after I'd come out of hospital and was eating the first meal I'd had since the accident that I realised I couldn't smell anything. So I trotted off to my GP and said, look, doc, I've had this really bad accident, lucky to be alive, but I can't smell anything. My doctor said, OK, I've heard of this happening before. It's very rare. We don't know very much about it. We don't know much about the sense of smell. There's nothing we can do. Might come back of its own accord. Give it 6 to 12 months. If it doesn't, you just have to live with it. And that was that. So no, I wasn't offered a smell test. I wasn't offered anything, frankly. I got no support and information, and that sort of, the shrug that I got from my doctor, and that so many of us are used to getting, led me to spend the next 6 years thinking I was one of the only people on the planet with this. This invisible sensory impairment that no one seemed to know anything about, least of all me. And it wasn't until 2011 when a book came out, which some of you may have read, called Season to Taste by Molly Birnbaum. Some heads nodding there. I read Molly's excellent book, and it was this absolute sort of road to Damascus moment, really, for me. I read about Thomas Hummel's work in there, wrote to Thomas about his smell training study. Thomas introduced me to Carl, and off we went. And then, yeah, so Fifth Sense has grown and developed quite a lot since then. I did it in my spare time for 10 years, and then at the beginning of last year, I was appointed as the charity's first chief executive officer, and since then, I've been doing it full time. And what we've been working really, really hard to do, so I've recruited a new team. What we're really trying hard to do is build on the significant awareness that has been created by COVID-19 and really sort of, as I keep saying to people, getting smell and taste impairment into the mainstream. Okay. This is sort of a quick summary of the change that we're driving in the UK. Under the strapline, it's time we talked about our sense of smell and taste. We ultimately want to ensure that everyone in the UK has access to a specialist smell and taste clinic who needs one. Point 2, in red and underlined for obvious reasons, we want to ensure that smell testing is routinely undertaken in public health settings. We're also working to widen access to education and training for all health and social care professionals. so we can get to the point where the shrug no longer happens. And we also want to encourage increased funding for research to improve our understanding of the causes, smell and taste dysfunction, develop new treatments, and also find new ways of helping people to live well with that condition. And then also, we really need to drive this recognition of the impact of smell and taste impairment by the government, public, and private sectors. In terms of smell testing in the UK, well, I do think that we are potentially a bit ahead of the game in the UK. So, by my reckoning, okay, we know that smell testing is undertaken in around or at least 10 NHS specialist rhinology or smell and taste clinics in England. Only in England. There's no specialist clinic in Scotland or in Wales. I'm working with a consultant in Scotland who we've known for a number of years since he was a registrar. And what we're doing is we're working with him to build a case to his local NHS body for why they should support him and fund him in setting up a specialist clinic there. The clinics in England typically use sniffing sticks. And that point on the bottom, I was forwarded an email last week from one hospital in the UK, which shall remain nameless, of course, saying we're not going to get these smell tests in. Why do we need to do it? So there's positive things going on, but there's also challenges in attitudes that we need to change. But what we're continuing to do is sort of work on the why that smell testing is needed. And the next slide is this is sort of one point. So as you all know, olfactory dysfunction is particularly prevalent in the older section of the population. What we did was look at the UK population as of 2021 and European population studies, and which suggests that those stats on the screen. So significant numbers of people, older people, may have olfactory dysfunction in the UK. I particularly, I think the one at the bottom, 4.2 million people over the age of 65 live alone in the UK, and more than a quarter of those may have olfactory dysfunction, which is particularly relevant to safety. And this is the area that Fifth Sense is a particular area of focus for us at the moment, and I'll come on to why in a minute. But natural gas, we know, as you know, that natural gas has a methyl mercaptan added to it to give it an odour. So, it's the smell of natural gas, well, the smell that's added to natural gas, that's basically, the olfactory equivalent of a red flashing light. But no one ever thought, did they? What if you can't smell it? Around 22 million households in the UK on the mains gas grid, all right? Going back to that stat, 1 million of these might be someone over the age of 65 living alone with olfactory dysfunction that means they can't smell that substance. Now, here's the best bit. You can't go out and buy a natural gas detector in a store in the UK, all right? Smoke detectors, carbon monoxide detectors, okay, no natural gas detector on the market, which is a bit bonkers, really, isn't it, when you think about it? We did a piece of work last year where we sent out a survey to Fifth Sense members, safety survey, to capture people's health concerns, safety concerns and experiences. So this is obviously people who self-identify as having a problem with the sense of smell. 432 responses, and 34% respondents said they'd had at least one gas safety scare at home in the last 5 years that they attributed to not being able to smell properly. And some of the comments and stories that came from that, some of them are fairly mind-boggling, frankly. I've got my own. About 11, 12 years ago, I was living in this flat in Leeds, in northern England, and it was a bit of a strange, in an old Victorian building, right? You had the kitchen off one side of the stairwell and the rest of the flat off the other. Me and my flatmate at the time, we had a gas cooker, we'd had dinner together that evening and gone out with our own separate groups of friends for the night for a few beers, a bit of a night out. I got home first, and at the time I smoked. I went into the kitchen with a unlit cigarette in one hand and a lighter in the other to get a beer out of the fridge. And I remember this quite well. I opened the fridge, got the beer out. I was about to light the cigarette, and I thought, no, actually, no, Duncan, because I'll get smoke in the stairwell when I go across. I'll wait till I go back to the other side. Went through, closed the door behind me, went and had my fag, my beer, went to bed. Next morning, I saw Adrian, my flatmate. He went, Dunk, we didn't turn the cooker off properly last night. He said he could smell the gas when he opened the downstairs door of the building. So like, I literally was this close to lighting a cigarette in a room that was full of gas that I couldn't smell. And it was only after that, at that point, that I thought, shit, I need to be really careful about this. Until that happened, it hadn't occurred to me that I ought to take steps to keep myself safe because I can't smell things. So fast forward from that and from this survey, we're now doing quite a big piece of work about it. So we're working with a company called Cadent. Cadent are the UK's largest gas distribution network. What that means is they basically own the gas pipes. There are 4 GDNs in the country. Cadent is the largest of them, and Cadent also run the National Gas Emergency Helpline. So anyone who can smell gas, that's the number you call. Cadent will send an engineer out. Cadent came to us in 2018 because Cadent and the other GDNs are funded by UK government to play a role in safeguarding customers with vulnerabilities. And they came to us and said, we've realised there's a whole body of the population we're not doing anything for, and that's people who can't smell and can't smell gas. We want to start working with you, Fifth Sense. And the relationship's gone on from there. The year before last, myself and the chair of our board, Robert, we worked on a funding bid to Cadent into this big pot of money they've been given by government for safeguarding vulnerable customers projects. And we were successful with that. We were awarded a grant of $471,000 over 3 years. That's about $580,000 for a big piece of work to enable people with smell dysfunction to stay safe and well at home through the provision of support and information, public engagement and awareness, and professional education. We're working with Cadent. We're also working with the NHS. We're working with the UK Fire and Rescue Service, and we're also working with our other commercial partners, Flavour Active, who train tasting panels in the beverage industry. And one of the things that we've developed with Cadent, at which point, there we go. Yeah, I brought some presents over for you. We've developed a scratch and sniff card. What to do if you smell gas, and it's got the smell of gas, methylmercaptan, on the front of it. And on the back, it's got information about how good is your sense of smell, and then staying safe, and also information about Fifth Sense as well. Cadent work closely with the Fire and Rescue Service in all of their operational areas. And what we've now got are fire and rescue services in different parts of the country. When they do their home safety visits with people who have identified as having some sort of vulnerability, they're taking these along with them, and they're getting people in the household to have a go with the scratch and sniff panel as a sort of a quick and simple assessment of whether someone at home might have a problem with the sense of smell that means they can't detect the smell of gas. Because, let's face it, if you can't smell the smell that's on the card, you're probably not going to be able to smell if it's coming out of your cooker. Okay, so this is something very simple but we've developed that is now being put to use in quite a wide scale. Cadent serve a big chunk of the population, so they deliver gas to 11 million homes and businesses in the UK. As I say, they're using the gas cards. Not all the fire and rescue services are using them, but some are. But we hope to persuade the others as we're going along. What we're also doing, we're in the process of developing an e-learning tool on smell and taste disorders that's going to then become part of standard HR training for all Cadent staff. It was originally going to be just the engineers, but now we had a meeting with Cadent last week who were really, really pleased with all the work we're doing with them, and they want to extend it out to all members of staff in Cadent. It's about 6,000 people, which is really, really exciting. Our work with the NHS. So this is getting really interesting. again, COVID has really sort of provided a platform, it's fair to say. I had a meeting in February with the group, basically the NHS England long COVID team, okay? We did a presentation on smell and taste disorders to that team, which was filmed and then put on this this online platform that they all use, that we've got access to now. And I put a post on there saying, I hope you enjoyed today's session. We've actually just started doing a bit of training, and we've done a bit of training for a couple of post-COVID services. Any services interested in this, get in touch and we'd be happy to help. Within 24 hours, we had over 30 responses. Since then, we've delivered a training package on smell and taste disorders, mainly focused on what are they, the impact that they have on people, and then how can NHS, how can health and social care professionals, what they can do to support their patients. So food advice, smell training, staying safe, We've delivered this to over 40 post-COVID services. What we've also done is we developed these smellability, these very simple scratch and sniff cards with 4 odours on them. We've been sending these to them, along with a little evaluation form. We've made it clear to them that this isn't a clinical test. It's not validated in any way. That's not the point. This is about giving them the opportunity to try out using a tool, okay, with their patients in a public health setting. And we asked them a few questions. So, did you find the cards useful in helping identify if someone has a problem with the sense of smell? Someone said easy for patients to use, and it provides a fact rather than patient just providing a story. Okay. Someone said useful, identified the level of smell. However, I found that odours did not represent what they actually were, causing some difficulties in assessing smell. It's a really good point, this, because in terms of people's perceptions of what something should smell like versus the synthetic version of that on a piece of card, that, as we were trying earlier, might not actually be that, they're not that strong, the odours on these cards either. Yeah, what it's doing is it's sort of helping show that this is a good thing. The healthcare professionals trying to think it's a good thing, but there's lots of learning we need to sort of do and build into what makes an effective smell test. Of course, we're not a research group. That's not what we're trying to do. What this is for us, it's more of a service evaluation project. We asked them, do you think that smell testing is a good idea? And so far the majority have said yes. Gives patients ownership, but need to be aware that treatment options are limited. And I think this is another point as well. We know this already. Reassurance for people who might turn up thinking, well, I can't smell anything. But for some, until they've actually tried, okay, they might not necessarily be aware that this isn't just a black or white situation. There's a sliding scale, and that different people are going to be at different points along it. And we also said, did your patient think that smell testing is a good idea? And again, the majority so far have said yes. Again, thing about ownership and validity. But again, this point about some of the odours on the card not being what people would expect them to be, that can cause frustrations for people. We're also, as part of our engagement and education programme that's being funded by Cadent, we've taken this successful body of training that we've done for the NHS post-COVID services, and we're starting to take it elsewhere. And we're starting to work with other charities in the UK that represent people where olfactory dysfunction might be an issue, stroke being one. So Helen from my team recently did a face-to-face event with about 50 members of staff from the Stroke Association in the Midlands, and she took the smell cards along. One of the team said they thought that the cards were amazing, really good idea. And we're now talking to them about a potential pilot project with the Stroke Association, whereby when people who have had a stroke come out of hospital, they're given a welcome pack with a range of information, and then they often get a face-to-face visit from a Stroke Association sort of support worker. And what we're going to look at is, could a simple smell screening check be done as part of that to help identify if someone's had a stroke and has experienced some smell impairment as part of that. and then again be given information and support to help them. So yeah, there's some really interesting opportunities and developments that are going on, and it's just it just feels like it's growing and growing, really. What's my next slide? What we're learning from this? Well, as I say, the individuals and organisations we're working with are very receptive to the idea of smell testing. And again, it's COVID that's made that change. Okay, when you've got, you know, the NHS services we've been doing the training for, they've come to us and said, we knew nothing about this. We knew nothing about smell test disorders, and all of a sudden we've got people, you know, crowds of people presenting saying, I've lost my sense of smell, I'm getting all these horrible smells, what do I do? And they knew nothing about it. So it's been really you know, really good to feel that we have been able to provide a level of input to help them. But you know, we want to build on that, and I'll come on to that in a moment. Yeah, different types of tests, smell tests, screening tools are likely to be needed for different purposes and different contexts. The whole thing about perception is going to be an issue. And yeah, long road ahead in terms of convincing policymakers of the need for smell testing to be undertaken more widely. But we're on it, and we're going to keep on pushing. Just to highlight a few other areas of a few other things that are going on that are relevant to conversations that have happened over the past couple of days. We've now got a really good sort of body of evidence from the NHS services that's telling us that one of the questions we asked them was, do you think that education training on smell and taste dysfunction should be provided for all health and social care professionals? And the answer near the university has been yes. Through the Member of Parliament in whose constituency Fifth Sense is based, I met her in person at a brain injury event at Parliament back in April, and she has written to the Department of Health and Social Care on our behalf using a briefing paper that I wrote for her, basically calling for Department of Health and Social Care to pay to fund an e-learning tool, okay, that would, on smell and taste disorders, that would sit on the NHS England e-learning for healthcare platform and be accessible for health and social care professionals right across the country. We're talking about £20,000, yeah? That's literally like money down the back of the sofa. Of course, what did they come back with? I mean, it was a long letter, but the answer was basically no. However, I'm not very good at taking no for an answer, so I've written back to the Minister, and I'm waiting for a response. But, you know, we'll get there with this. We'll get there. I think, you know, as I was saying yesterday, we've got an osmia onto the medical licensing assessment content map, and we can build on that and start looking at how we get smell and taste disorders onto the curriculum for medical schools. And one of Carl Philpott's students has just taken on this project. She's going to be writing to all medical schools in the UK to find out what, if any, content they have on their curriculum about smell and taste, and that'd be a useful starting point. We've also, and speaking to the presentation you've just done, we've just won some funding for a project to start exploring barriers to or reasons why people from minority communities do not typically present with smell and taste disorders. So that project is going to be starting in December. It's only a few months. It's only going to run for a few months. One of the outputs of that is going to be an equality, diversity and inclusion strategy that's going to inform our work, particularly inform the direction of our Cadent-funded project. And when that's done and dusted and publicly available, it would be great to be able to share that with you all. What else? We're also going to be, again, as part of the Cadent project, we're going to be doing some smell and taste roadshows in major shopping centres, shopping malls around the UK. And occasionally I have a day off. But yeah, I mean, listen, we had the Fifth Sense National Conference in Sheffield in England on Saturday, which Steve came over and joined us for and spoke at. Following being at that and following being at this event, you know, we've got some big challenges ahead, okay? But I'm really excited about what the future has in store for this area, because I feel that we're starting to ride a bit of a wave, okay? that people are listening now. They weren't listening before. People are listening, and we can keep building on this. And through working together, yeah, and sharing learning, sharing successes in the UK and in the US, we can get smell and taste into the mainstream. And yeah, really looking forward to working together on it. And we as an organisation always open to collaboration. So yeah, any sort of projects, work that's going on, yeah, come and talk to me. Thank you all very much indeed.
Thank you very much. Very exciting.